there's a hidden truth most seniors will never hear from their doctors. Every year, millions of older adults line up for routine health checkups, believing they're protecting their health. But what if I told you that some of these tests, yes, even the ones your doctor recommends, could actually bring you closer to surgery, stroke, or even cancer? New research shows that nearly 37% of medical testing in seniors leads to unnecessary treatments, complications, or lifelong side effects. Even more shocking, 99% of people over 70 have no idea they're being overtested. One checkup on this list, number 1, in fact, is now believed to be responsible for 5% of all cancer cases in the US, the same rate caused by drinking alcohol daily. You won't hear this at your clinic or see it on a billboard. But the truth is buried deep in the science, and today we're digging it up. In this video, we're revealing the 5 medical checkups seniors over 70 should think twice about, and the surprising ways they may actually harm your health. All backed by real data, real cases, and trust us, you won't believe what's number 2. But before we dive in, we want to hear from you. Tell us in the comments, where are you watching from? How old are you? Have you ever regretted a test or procedure? Do you think seniors are being tested too often? We read and respond to every comment with personalized tips and advice. And don't forget to like this video and subscribe for more helpful content just like this. Let's get started. Here's the first checkup that seems harmless, but could quietly damage your quality of life. Number 5, bone density scan. It sounds simple enough, quick, painless, and it tells you if your bones are at risk of breaking. But past age 70, bone density scans, officially called DEXA scans, often cause more anxiety than benefit. These scans detect osteoporosis by measuring bone strength, but in older adults, especially women, they nearly always show reduced density, even when there's no serious threat. Why? Because bone loss is part of normal aging. Just like wrinkles and gray hair, it happens to everyone. Despite this, many seniors are prescribed medications like bisphosphonates, intended to strengthen bones, but these come with serious risks. Jaw necrosis, where jawbone begins to die, esophageal irritation, and digestive problems. What's more, research has shown that treating mild bone loss in people over 70 with medication offers very little real benefit. One study in the Journal of the American Geriatric Society followed 1,200 women over 70. After 5 years, bisphosphonates reduced fracture risk by just 0.3%. That's almost nothing, especially compared to the side effects. Take Rose, a 76-year-old retired piano teacher. She was sent for a DEXA scan during a routine checkup. She had no pain, no history of falls, and walked daily. The scan showed osteopenia, a mild form of bone loss. Her doctor immediately put her on alendronate, a bisphosphonate. Within 3 months, she had severe acid reflux and jaw pain. She stopped playing piano altogether. We helped her taper off the medication and start a better regimen. Vitamin D supplements, resistance band exercises, and a calcium-rich diet with leafy greens and sardines. A year later, she was back on stage, performing again. No fractures, better balance, and stronger legs. For seniors who aren't falling or breaking bones, the smarter option is lifestyle. Balance exercises, strength training, proper nutrition, and addressing vitamin D deficiency. According to a 2022 Osteoporosis International study, this approach can cut fracture risk by over 20%. Don't let a scan and a scary number push you into unnecessary treatment. And now, let's talk about the next test on our list, one that could lead you all the way to brain surgery. Number 4, cardiac stress test. If you're feeling more tired lately or experiencing mild chest tightness, a stress test might seem like a smart precaution. But for seniors over 70, especially those with no obvious heart symptoms, it may do more harm than good. The cardiac stress test, done on a treadmill or with medication, checks for blocked arteries. But in older adults, it often produces false positives, up to 40% of the time. That means you could be sent for further testing, like angiograms, or even unnecessary procedures like stents or bypass surgery. A 2017 JAMA cardiology study found that over half of all stents placed after stress tests were done in people with no significant symptoms, and those patients saw no real benefit in terms of survival or quality of life. Raymond, a 75-year-old retired postman, walked every day but felt tired on hills. A stress test led to a catheterization and a stent for a mild narrowing, but the contrast dye used caused a kidney reaction, landing him in the hospital for 6 days. His fatigue never improved because his heart was never the problem. Unless you're experiencing classic symptoms like chest pain during activity, shortness of breath, or sudden drops in energy, a resting EKG or coronary calcium scan is often safer and more appropriate. Number 3. Brain MRI for memory loss. Feeling forgetful or mentally foggy can be terrifying, especially as we age. So when older adults report memory concerns, doctors often order an MRI. But here's the uncomfortable truth. Brain MRIs rarely offer useful answers in seniors with mild memory problems. Most just show age-related changes, slight brain shrinkage, or white matter spots that are totally normal. The danger? These normal findings often trigger fear, further testing, and even invasive procedures. In a 2021 Neurology Today study of over 3,000 seniors aged 70 to 85, 86% had abnormal MRI findings, but only 3% of them were linked to an actual treatable issue. That means 97% of patients went through emotional distress for nothing. Even wiser, 12% were sent for invasive tests like spinal taps or brain biopsies based on vague MRI results. James, a 74-year-old retired engineer, started misplacing his keys and forgetting names. His doctor ordered an MRI, which showed white matter changes. George panicked, convinced he had dementia. He stopped driving, stopped going to church, and his anxiety worsened. When we evaluated him with a standard cognitive screening test, his results were completely normal. We focused on lifestyle, better sleep, hydration, brain games, and within 3 months, his memory stabilized and his confidence returned. The truth is, unless you're experiencing seizures, drastic personality changes, or rapid decline, a simple cognitive screening test is often a better first step. It's cheap, quick, and avoids unnecessary panic. And now, brace yourself. The next test on this list is one almost every senior has had. Number 2. Colonoscopy. Surprised? Most people are. But colonoscopies, while life-saving in the right circumstances, can be risky after age 70 and are rarely recommended after 75 without clear symptoms. The prep involves strong laxatives that can cause dehydration, dizziness, or kidney problems. Sedation carries its own risks for older adults, including memory issues. And the procedure itself can lead to bleeding, bowel perforation, or heart rhythm problems. In a 2019 JAMA internal medicine study of 1.3 million Medicare patients over 70, every 1,000 colonoscopies, only 2 lives were saved, while over 20 patients had serious complications. Amelia, a healthy 73-year-old baker, had no symptoms and no family history. Her new doctor pushed for a colonoscopy. A small polyp was removed, but later that night she collapsed with abdominal pain. She was hospitalized for 9 days and never fully recovered. She had already had 2 clean colonoscopies in the past. This one wasn't needed. The U.S. Preventive Services Task Force recommends stopping routine colonoscopies at 75. Safer alternatives include the FIT test, a non-invasive stool test done at home with no prep or sedation. Number 1. Annual full-body CT scans. Now, for the most dangerous and overused checkmate, the full-body CT scan. Marketed as a preventive tool, it's popular at high-end clinics and executive health programs. But the radiation exposure is massive, equal to 500 chest X-rays. And the risk? According to a 2023 JAMA internal medicine modeling study, CT scans may now be responsible for up to 5% of all cancers, putting them on par with alcohol as a cancer-causing factor. These scans often detect harmless nodules or cysts, but once spotted, they lead to more scans, biopsies, and even unnecessary surgeries. Lucas, an 80-year-old martial arts instructor, felt great. His full-body scan showed a 3-milliliter lung nodule. He went through a PET scan, then a needle biopsy, which collapsed part of his lung. He spent 2 months recovering. The nodule? Completely benign. Experts now strongly advise against full-body CT scans for people without symptoms. If you have signs like unexplained weight loss or coughing up blood, Targeted imaging is appropriate, but scanning everything just to check can lead to more harm than help.